and welcome back to the Mama Doc Baby Doc podcast.
Hello, I'm Renda, a board certified OBGYN physician, and I'm here today with my daughter Rachel, who is a pediatrician.
Hello, Mom.
Hi,
Are
Rachel.
you finally back home? You look like you're back home.
I'm back home after all my traveling. That's one of the perks of having family that live all over in different places. I get to go
Yeah.
visit them. Yeah.
Yeah, it's so nice.
Yeah.
Yes, we were all together a couple weeks ago now in Tennessee before the hurricane hit.
Before the
Thank
flood. Yeah.
goodness.
Yeah.
Yeah, which is horrible. So sorry. We're praying for everyone in the path of the hurricane. But we celebrated my grandmother, my mom's 80th birthday.
That's right. Yeah.
And we
Yeah.
surprised her. I think I was scared she was going to have a heart attack because she was so shocked.
She was so surprised. That's true. I'm
Yeah,
glad
it
she
was
didn't.
really
Oh,
sweet. She started
yeah.
crying and
Yeah.
yeah, it was
Yeah.
really great and really fun.
Yeah.
But today we have a really fun episode planned, and it's all about uterine fibroids and pregnancy.
That's right. And I want to say to all our listeners, I want to say thank you. Thank you for being here, for spending some of your time with us today. Today, you're going to learn about uterine fibroids and pregnancy. And, I've actually gotten quite a few questions about this, more than I expected. And the questions indicate that there's just a lot of uncertainty, maybe a little bit of misunderstanding too about fibroids and pregnancy. And a lot of people are afraid of it. There's fear out there too. So, in this episode, we'll talk about fibroids in general outside of pregnancy because it's important to understand that in order to understand how they impact a pregnancy.
Yeah, I know. I have unfortunately some experience with this, and I was
Yeah,
also terrified. So I wish I would have
right,
had this episode to listen to.
right.
So Um, let's start by talking about what fibroids are, how common they are, some risk factors for fibroids, and then let's go into kind of what happens with uterine fibroids in pregnancy. So, what are some of the symptoms that you may experience if you have fibroids?
Okay, right. So first of all, fibroids are non-cancerous tumors. They're tumors that come from smooth muscle cells, and that's the muscle layer in the uterine wall. And the uterus has three layers. The innermost layer is the endometrium, and that's the layer that sheds when women have a period, a menstrual period. Then the thick or middle layer, the muscle layer, that's called the myometrium, and that's where fibroids develop from smooth muscle cells in the myometrium. And then the outermost layer of the uterus is the serosal layer. And that's kind of a thin, filmy layer that overlays the uterus. It's kind of like the skin on the outside of the uterus. Now, fibroids can also be referred to as myomas. The medical term is leiomyoma, but I'm just going to say fibroids during this episode because that's a lot easier. And fibroids happen almost exclusively in reproductive age women. We don't see them in children. We also don't see new fibroids developing after menopause. You may see them in younger women, very, very, very rarely in adolescence, but mostly it's in reproductive age women. And many times fibroids are completely asymptomatic. They don't cause any symptoms at all. So often they're incidental findings. And a lot of women have no idea that they have fibroids. But there are some women who do have symptoms, and those symptoms are usually things like abnormal uterine bleeding, heavy menstrual periods, or sometimes irregular bleeding and spotting in between cycles. And then there can also be symptoms just from the size of the fibroids being there. And typically that manifests as pelvic pain or pelvic pressure, like a fullness in the pelvis.
Hmm. Okay. Um, I've heard of fibroids described by their location within the uterus too. So tell us a little bit about that.
Right. So submucosal fibroids, those are fibroids that are in the muscle layer, but they're really close to the endometrium or to the inside of the uterine cavity. Those are submucosal, just under that mucosal lining. And we classify these roughly as protruding into the uterine cavity less than 50% or greater than 50%. So these, again, are the ones that are closest to the lining of the uterine cavity, and they're more likely to cause bleeding problems. The intramural fibroids are mostly in the wall, and that's the muscle layer of the uterus. Subserosal fibroids are fibroids that are closer to the serosal side, or so on the outside of the uterine wall, just under the skin of the uterus. And they can sometimes be pedunculated, meaning they've got this little stalk and they're kind of hanging off on a stalk. And so, again, fibroids are either closer to the endometrium, protruding into the lining. They can be submucosal or intramural in the wall. And then subserosal is on the outermost part of the uterus. And they can be pedunculated or hanging off on a little stalk. Now, some women can have fibroids down in the cervix. And fibroids in the cervix, that's a little bit rare, but it is a possibility. I've seen fibroids out in the broad ligament, which is a flap of tissue adjacent to the uterus that were actually even
Oh,
separate
wow.
from the uterus itself. Yeah. Yeah.
Wow. Wow. So how common are fibroids?
Oh, they're really common. Yeah. Fibroids are the most common pelvic tumors in women. It's hard to know exactly how common they are because studies are done in people who have symptoms, right? Or they're done when we look at a uterus after a hysterectomy. And hysterectomy, that's the surgery where we remove the uterus. And that's how we look at how often fibroids occur. So we don't necessarily capture the women who are just walking around and have fibroids, but really don't have any symptoms, because in that case, we wouldn't be looking for them. They wouldn't be getting ultrasounds or other imaging studies. Now, with that being said, we do have some data about fibroids, and it varies. But in general, some studies say as low as 7% of white women and around 25% of Black or African American women. So they're pretty common. Some studies say that up to 50% of women may have fibroids. The prevalence increases as we get older, closer to menopause. They're more frequent in women who are like in their 30s to 40s. But the good news is that after menopause, they actually do shrink. They don't grow after menopause in general because they're very responsive to hormones.
Okay. So fibroids are found in reproductive age women, but they increase in prevalence as we get older. And then after menopause, they tend to shrink or at least not continue to grow.
Right.
So, what are some risk factors for fibroids?
Well, one of the biggest risk factors is race, actually. Black women have 2 to 3 times greater risk of fibroids than white women. And we don't know exactly why that is. It's been hypothesized that there are differences in genetic factors or diet, lifestyle, stress. I mean, but come on, we all have lifestyle and stress issues. Also, maybe
Yeah.
environmental exposures might be different between Black and white women, and that could contribute some to the disparity. But again, we don't really know why for sure.
Yeah.
There are lots of studies currently being done, so hopefully we'll get some more data on that. But there's definitely a big disparity and difference with race. There also are some differences in the natural history of fibroids by race. So most white women with symptomatic fibroids are in their 30s to 40s. But Black women will typically develop symptoms on average 4 to 6 years younger. And they can even have issues with fibroids in their 20s. So it also appears that fibroids grow at a slower rate after age 45 in white women, but not in Black women. They continue to grow right up until menopause. And
Hmm.
again, we don't necessarily understand those differences, but we're working to try to understand them.
I wonder, being a pediatrician, I learn that puberty starts earlier in Black women too. So
It
they're
does. Right.
exposed to hormones earlier. So I wonder if that might be
Right.
why, or at least
Right.
part of it, you know.
Yeah,
But
likely
so
is.
that's
Yeah.
yeah, that's really interesting. Now let's talk about some things that influence fibroids developing. What things can increase or decrease your risk of getting fibroids? Obviously, race, but that's not something you can change. So, what else can contribute?
Right. So, one thing that influences fibroids is if you have one or more pregnancies that go beyond 20 weeks. That actually increases your chance of having fibroids. Again, we don't know why that happens, but having a pregnancy that goes beyond 20 weeks will decrease the chances of fibroids happening. So have lots of babies. That's one thing you can do.
Yeah.
On the flip side, early periods. So if you're starting your period early, particularly less than 10 years old, and I know that sounds crazy young, but starting your period early is associated with an increased risk of developing fibroids. So you're right, Rachel. Black women do tend to have their periods start at an earlier
Mhm.
age. They go through puberty a little earlier. So that could be,
Maybe.
it's definitely associated with a higher risk. And,
Yeah.
it could be because there's a longer reproductive lifespan. If your periods are starting technically, then you can get pregnant sooner, right? So that may be part of it. And it's also thought that this may be part of the reasons why they're more common in Black women, because their periods are earlier. Yeah.
So hormones, it sounds like, make fibroids worse. Is that right?
So, hormones the hormone levels don't actually make fibroids worse. You would think that maybe it would be because they're more active in the reproductive years when hormones are active. But like, for example, using low dose birth control pills or regular birth control pills, they don't tend to make fibroids grow.
Hmm.
They don't really have an effect. And we often use birth control pills to help control symptoms, especially women that are having the heavy or irregular bleeding. Using birth control pills can actually control the symptoms, and they don't seem to make the fibroids get any bigger, any quicker, or make them worse. Now, birth control pills typically have both estrogen and progesterone. Sometimes we can also use long acting progestin, like a progestin only birth control pill, or something like Depo-Provera or Nexplanon, that implantable device. And those can protect against the development of fibroids. Progestin only birth
Nice.
control pills or the progestin intrauterine device like Mirena or Kylena have been shown that they can maybe decrease the size of fibroids by just a little bit, not a lot. But contraception with only progesterone, that also might actually decrease fibroid size. So I'm often prescribing progesterone only to treat abnormal or heavy bleeding caused by fibroids. And it may actually slightly decrease the size of fibroids as well.
Nice. That's awesome. Okay. So what are some other things that can influence fibroids?
Well, there is a relationship between fibroids and weight. So, obesity, that's a risk factor. Um, and there are also some differences in fibroid development related to diet. So it's been shown that significant consumption of red meat, specifically ham, is associated with an
Mm.
increased risk of fibroids, anywhere from 1.3 to 1.7 times increased risk of getting fibroids. And then consumption of green vegetables and fruit, especially citrus fruits like oranges, can maybe even decrease the risk of fibroids. Yeah.
Oh man, I love ham. That's so unfortunate.
So
You can ask
unfortunate.
the girls at work. I eat a ham sandwich like once every couple weeks, okay? I go to Jimmy
Yep.
John's and I get me a ham sandwich. So maybe I
Yeah.
could still continue to do that, but then just eat some green veggies and oranges,
Yep.
maybe.
And oranges,
Okay.
oranges and salad.
Yeah.
Yep.
Maybe they'll offset a ham sandwich and an orange. Um, so can people decrease the size of their fibroids by changing their diet? Like, if
Yeah.
I were
I
to
mean,
stop eating ham sandwiches?
it might help. I mean, I have seen cases where women have had a dramatic decrease in the size of their fibroids based on changing their diet, particularly
Wow,
going vegetarian or vegan.
I
Now
can't
that's
do
just
that,
antidote.
sorry.
I know. So that's just my anecdotal experience. It's not proven by
Okay.
studies that changing your diet will make the fibroids go away, but studies do show that if you consume more vegetables and fruit, you decrease the risk of fibroids.
Hmm.
Also, vitamin A may decrease the risk of fibroids. And the best way to get vitamin A, particularly from animal sources, is like salmon, tuna, and cheeses. And that may decrease the risk of fibroids. There's also increasing evidence that vitamin D deficiency can significantly increase fibroids, right? So take your
Wow.
vitamin D. Yeah,
Yeah, I think we're gonna find that vitamin D deficiency does a lot more than we really think it does. I think there's gonna
right,
be a lot of studies showing that. So yeah,
right.
take your vitamin D. So what about things like caffeine or alcohol? Does that play a role in fibroid?
Yeah,
development?
so caffeine is not a risk factor for fibroids, so you can keep drinking your coffee, okay? Keep drinking your caffeinated beverages. But alcohol, however, is a risk factor for fibroids, especially beer.
Boo.
And that does appear to increase the risk of developing fibroids. And then, oddly enough, okay, I'm not recommending this, but smoking decreases the risk of
Huh,
having fibroids. So,
strange.
obviously, that is not a good reason to start smoking, but smoking does decrease the risk of fibroids. So, yeah,
Oh,
okay,
that's weird. Yeah, that's really
yeah,
weird. It's like the one good thing smoking can do.
right,
Um,
right.
so you told us that fibroids are more common in Black women. So is there a genetic component? Are the studies
Yeah,
showing that it's genetic?
Yeah, there is. So the tendency to develop fibroids does run in families, whether it's between mothers and daughters or sisters. There's definitely some genetic predisposition there. Other things that can increase your risk include having high blood pressure or hypertension. That will also give you an increased risk of fibroids. Yeah.
Hmm, interesting.
Yeah.
Okay, so now let's go and talk about fibroids in pregnancy. Does that happen?
Yeah, so it's a little difficult to tell exactly how common fibroids are in pregnancy, although we do ultrasounds typically in pregnancy, especially small fibroids. We may not see them, but roughly it's estimated that fibroids affect somewhere from 2 to 10% of all pregnancies. And the prevalence of fibroids increases as we have older moms, right?
Yeah.
So during
Okay, so what
pregnancy,
happens with Oh, sorry. What happens with the course of fibroids during pregnancy? We know that there are a lot of hormones in pregnancy, and fibroids, are influenced by hormones because they happen in reproductive age women. So we know that the uterus is growing during pregnancy. So how does that impact fibroids? Also, there's a tremendous increase in blood flow to the uterus during
right?
pregnancy. So how does that impact fibroids as well?
Well, most fibroids are actually going to remain stable for most women throughout their pregnancy. So if you are pregnant and your doctor finds a fibroid, do not panic. Chances are it's probably not going to be a problem and is likely to remain stable throughout your pregnancy. In about 50% of cases, fibroids stay the same. They won't get any bigger, they won't get any smaller. They will stay the same during pregnancy. And then in the other 50% or so, about half of those are going to increase in size, and the rest may actually decrease in size. Yeah.
Nice. Yeah, I remember you telling me that. So, can you tell which ones are more likely to grow versus which ones are more likely to
Yeah.
shrink?
There's not a good hard and fast way to predict which ones are going to grow, but we do have some factors that give us some clues. For example, larger fibroids, those that are greater than 5 centimeters, are actually more likely to grow, whereas the smaller fibroids are more likely to remain stable in size. And even with fibroids that do increase, they usually don't increase by a significant amount, but there are a few that will increase by more than 25%. Also, they don't grow in a linear fashion. What we see is that the most growth occurs actually in the first trimester, with little or less growth occurring in the second or third trimesters.
Assuring that if you have fibroids that there is a good chance that the fibroid will remain stable, and if it does grow, it's not likely to grow by a lot. And most
And then in the postpartum period, 90% of fibroids are going to shrink after pregnancy. They'll get smaller when you look at them 3 to 6 months postpartum. So that's also really reassuring news. And that kind of goes along with what I said earlier, that if you have children, then it can decrease your risk of fibroids.
Nice. Okay, so what are the symptoms of fibroids as they relate to pregnancy?
Yeah, the good news is that usually they're completely asymptomatic, and most people don't have any issues with their fibroids at all during pregnancy. Now, if you do have symptoms, the symptoms are typically pain or pelvic pressure. It's rare for fibroids to cause bleeding in pregnancy. The most common symptom is by far pain, and the frequency of pain increases with the increasing size of the fibroids. And again, that just makes sense, right?
Yeah. When you have this big tumor growing in the muscle of your uterus, as your uterus stretches, it's going to cause some discomfort, particularly if it's really big. I've seen patients with fibroids that are really large, even 10 centimeters, and those are likely to cause some discomfort.
Right. Yeah, absolutely. And most patients only have localized pain. They feel the pain right where the fibroid is. And sometimes you can even have a little bit of fever with it. Sometimes patients have nausea or vomiting. That's not very common. The most common symptom is pain, and it's usually pain right where the fibroid is. Now, that pain typically presents in the first trimester or in the early second trimester, and that corresponds to the period of most rapid growth for the fibroids.
Okay, so pain most likely in the first trimester or the early second trimester, but sometimes that pain can happen at any point in pregnancy. That's what we're saying.
Right. Yeah. And pain typically comes from something called degeneration of the fibroid. So, what happens is that if the fibroid grows in size, it can grow faster than the blood supply to the fibroid. And that can lead to a circumstance where the fibroid is actually not getting enough blood to keep up with the growth. And that causes the fibroid to start to die in the middle, something called necrosis. And that's really painful. And that's the most often reason why pain occurs. Now, rarely there can also be torsion, and that usually happens with the pedunculated fibroids, the ones that are growing on a little stalk. They actually grow and then they twist on themselves, and that twisting cuts off the blood supply. So the fibroid starts to necrose, and it can be very painful.
Yeah, that sounds painful. Um, okay, now let's go through some other complications and things that can potentially happen during pregnancy related to fibroids.
Yeah, okay. So we just talked about degeneration. That's the most common thing that happens, and it's associated with pain. Miscarriage, that's a bad one, and that can
Yeah.
happen in patients with fibroids, especially the ones that have the submucosal fibroids, the ones that are closest to the endometrium. You know, when the egg is fertilized and it implants in the uterine wall, if that implants right over where the fibroid is, it can affect the implantation or how well the placenta digs into the wall. And if the placenta doesn't implant well, it can affect the ability of the placenta to establish normal blood flow. And then the developing baby doesn't get enough nutrients or oxygen. And that can potentially increase the risk for miscarriage. It's much more common with the submucosal fibroids, and larger fibroids have a higher risk. So we don't usually see this happen with the intramural fibroids, those that are in the wall of the uterus, and definitely not with the pedunculated or the subserosal fibroids. They don't cause miscarriage. The risk is with those that are submucosal, that are just under the lining. And the more submucosal fibroids you have, of course, then the higher the risk.
Yeah, that makes sense. It can be difficult for the placenta to implant properly because the fibroids are distorting the normal anatomy right there. So that makes sense.
Yeah. And there's also an increased risk of preterm labor and preterm birth in pregnancies with uterine fibroids. The risk is higher with multiple fibroids, or if the placenta is near the fibroid, or if the fibroid is really large in size. Fibroids can also increase the risk of bleeding during pregnancy, as well as something called placental abruption.
Yeah, that's so bad. Placental abruption can be life-threatening. So tell us a little bit about that.
Yeah, placental abruption is when the placenta separates away from the wall of the uterus prematurely. So the placenta is not supposed to separate away from the wall of the uterus until after the baby's delivered, because being connected to the uterine wall is how it connects to mom's blood supply and how the blood flow to the baby to get the baby food and oxygen happens. So the placenta has to stay firmly attached to the uterus until after the baby is born. Placental abruption is when the placenta detaches before the baby is born, and it can be really, really bad. It really dangerous in certain circumstances. There is an increased risk of placental abruption with fibroids, especially if the fibroid is near where the placenta is. Then that's going to increase the chances of an abruption. And also, if the fibroid is bigger, that can increase the risk of abruption as well.
Right. Okay, now before we make all the pregnant moms out there with fibroids worry and
Yeah.
freak out and
Yeah.
give them anxiety, I remember you said that most women with fibroids will have no complications during pregnancy related to fibroids.
Yes, that's absolutely right. Most pregnant women do not have any complications during their pregnancy or their birth related to fibroids. But I do want to make everyone aware of the possible things that can happen. So let's continue to go through that list. The next
Yay.
one on the list is, I know, yeah, boo. The next one is malpresentation, meaning the baby presents in a presentation other than head down. And that happens if a large fibroid distorts the shape of the uterine cavity and makes it so the baby can't settle in to a position ready for delivery that's head down. That's going to be related to larger fibroids, particularly those over 10 centimeters. So the really big fibroids make it hard for the baby to turn inside the uterus and get into the right position. And malpresentation is also a possibility, especially if the fibroid is located down low in the uterus or if it's in the cervix. There may not be enough room for the baby to get his or her head down into mom's pelvis. So sometimes the outlet can be blocked by the fibroid. Dysfunctional labor is also a possibility. Fibroids are in that muscle layer of the uterus. And if those muscles, they have to work, they're pushing the baby out. And if
Yeah.
they are having to work around a fibroid, that tumor that's there, particularly if it's really large, it can decrease the force of the contractions.
Yeah, that's right. Contractions happen in that muscle layer of the uterus. So it can make
Right.
it difficult for the uterus to have that nice coordinated contraction or spread that contraction all through the muscle layer. It's hard to contract with a big tumor blocking the muscle fibers
Right.
from being able to
Right.
contract.
Absolutely. And that can lead to a dysfunctional labor pattern where the contractions just aren't as strong as we'd like, or they're not as regular as we'd like because the uterus can't quite get the contractions coordinated around the fibroids. And then finally, fibroids are associated with an increased risk of C section, cesarean birth, especially if the fibroids are located in the lower part of the uterus. And part of it is related to malpresentation, meaning
Mhm.
the baby can't get in the right position. But part of it could also be related to dysfunctional labor. And some of it may be related to a literal obstruction of the baby being able to come out. If the fibroid is in the way of the baby coming through the vagina, then that's going to increase the risk of C section as well.
Yeah, also, the higher C-section risk could be due to the increased risk of placental abruption. Those
Yeah.
babies have to be delivered by emergency C-section. So I can see how it's hard to determine which one of these factors is the most strongly associated, but all of those things together can increase the risk for cesarean birth.
Right. So, fibroids can also increase the risk of postpartum hemorrhage. A slightly increased risk of postpartum hemorrhage with fibroids, especially if fibroids are larger and if they're near where the placenta was, and also if the delivery is by C section. So, after delivery and the baby is out and the placenta is out, the uterus has to contract down, and that's how bleeding stops. Well, if there's this big tumor in the wall of the uterus, that can keep the uterus from being able to contract down. So then the bleeding just keeps going. Yeah, just continues.
Yikes. Yeah. Um, now I know we just talked about a lot of potential complications a fibroid can cause, but let me reiterate that most women with fibroids do
Right.
not have any significant problems or issues or complications during pregnancy or birth.
Absolutely. Most women do not have any issues or complications from their fibroids. But the most common thing that I see for sure is pain. If something is going to happen, it's almost always pain from the degenerating fibroid. But most people do not have any other issues related to fibroids. Now, I do want to take a moment and mention some things that are not associated with fibroids. So, some things that you do not have to worry about. An increased risk of preterm premature rupture of membranes for your water breaking early. Fibroids do not increase the risk of your water breaking early. They don't increase the risk of a placenta previa, which is where the placenta overlies the opening to the cervix. So, fibroids do not increase the risk of a previa. They do not increase the risk of stillbirth. Also, another good thing to know, they do not increase your risk of preeclampsia. So, although fibroids do have some things that they're associated with, there are some things that are definitely not increased with fibroids. So, that's good news too,
That's
right?
good. Yeah, that's good. That really is good to know. So now let's talk about how you're going to manage the fibroids during pregnancy. What do you guys do?
Right. So, first of all, if I have a patient with known uterine fibroids who wants to get pregnant, who's planning to get pregnant, we're going to have a discussion about maybe potentially having fibroids removed before they get pregnant in order to reduce the risk of any complications. And that decision really has to be made on an individual basis. And it depends on a lot of different factors. It depends on the patient's age. It depends on their past pregnancy history. It depends on the severity of any symptoms that they're having before they get pregnant. It depends on the size and the location of the fibroid. And it's really an individual approach based on each patient's risk factors. But that is something to consider. If you know that you have fibroids, then you just may want to talk with your doctor about whether it's worthwhile or whether it's appropriate or beneficial to have them removed prior to getting pregnant. Now, as far as how we manage things that may pop up related to fibroids, as I said multiple times, the most common thing is going to be pain. Very rarely, pregnant women require a hospitalization for pain management related to fibroids. When a fibroid degenerates, it's actually dying tissue, and that is painful. Okay. So we treat the pain. We start with Tylenol. We don't have a lot of pain medication, pain management options available other than Tylenol. We can use anti-inflammatory medicines like non-steroidal anti-inflammatory drugs like Motrin or ibuprofen or Aleve, but we can only use those for a short course, less than 48 hours or around 48 hours, or ideally less than 48 hours, because they can have some adverse effects on pregnancy. They can cause
Yeah.
oligohydramnios, where the fluid level is low. They can cause issues in the baby's heart if used for a
Yeah.
long period of time. So we really want to avoid NSAIDs for longer than 48 hours if possible. And if for some reason we do it longer than that, then typically we do weekly ultrasounds to check on the baby. But we do use Tylenol in combination with anti-inflammatory medicines for a short period of time.
Yeah, so the pain from a degenerating fibroid is self-limiting, right? It goes away on its own. There's a time frame that it's happening
Right.
and it's eventually going to go away. So how long does it usually last?
Right. So it is short term, and usually it only lasts a few days. And once we get
Okay.
patients over that hump, then typically things are going to be okay.
Okay, that's not bad. We can do anything for a couple days. If the Tylenol and the NSAIDs aren't working for the pain, then what else can you do?
Yeah, that's a good question. So we do sometimes add opioid medications if needed for pain management. We have to be careful about using opioids, right? Because longer opioid use can increase the risk of dependence. But we can certainly use them for a short period of time. So we use things like Percocet, which is a combination of oxycodone and Tylenol. And oxycodone, hydrocodone, those are all opioids.
Okay. Yep. So, what are the other options for treatment of fibroids? I know that when a woman is not pregnant, you often use hormones to treat the symptoms. You mentioned birth control pills or progesterone. Also, I've heard of using medications that stop hormone production for a short period
Right.
of time and effectively put women into a state that mimics menopause. And this is really just done short term, but it can help shrink the fibroids. Can you use any of these treatments in pregnancy?
Yeah, no. Unfortunately, no.
Mhm.
None of those can be
Darn.
used in pregnancy. So we don't use hormones. We can't use medications that throw you into menopause and pregnancy. So really, our only options are pain management medications. Um, the other option for treatment of fibroids outside of pregnancy, when a woman is not pregnant, is procedures or surgeries where we block the blood flow to the fibroid itself. And that as best we can anyway. We can use something called high frequency ultrasound to basically make the fibroid die. So we do procedures to remove the fibroid itself, or sometimes a hysterectomy. Obviously, not if someone's wanting to get pregnant.
Yeah.
And you can imagine that none of those treatments are done during pregnancy, right? We can't do the high frequency
Yeah.
ultrasound to make the fibroid die. We can't do a procedure and remove a fibroid while a woman's pregnant. So there aren't a lot of other options out there. We don't use the hormonal treatments because we have a baby who's developing and we want the hormones for the baby to be appropriate, right? Yeah.
Yeah, yeah, that makes sense. Okay, so let's talk about delivery with uterine fibroids. I know you said that fibroids can increase the risk for C-sections, but I do think that most patients who have fibroids have a normal vaginal delivery, right?
Yes, absolutely. Most women with fibroids are able to have a successful vaginal birth, no problem.
Good.
And you know, we
Nice.
we actually really prefer to avoid a C-section birth if we can with fibroids, because
Yeah,
depending on the location, the bleeding can be quite significant. And if you have to go through a fibroid to get through to the baby, like cut through a fibroid to get to where the baby is, that can definitely increase the risk of hemorrhage. So we absolutely always prefer a vaginal birth for sure in women who have fibroids, definitely.
that makes sense. That makes sense. But depending on the location of the fibroid, a C-section can maybe be inevitable, like it has to happen. Is that right?
Yeah, that is right. And so we occasionally can know that the baby's not going to be able to get down into the birth canal. So then we might plan a C-section birth if the fibroid is in a place where we know it's going to obstruct labor, and we're going to plan it as best we can to have, blood products available, support staff available, all those things ready and available, because when we expect a larger blood loss from that, but in general, we can limit the blood loss as well. There are things that we do to limit blood loss during the surgery. But we definitely want to try for a vaginal birth if possible. And most women are going to have a vaginal birth.
Yeah.
But if you do end up needing a C-section, please know that most of the time things go just fine. And it's not an issue and not a problem. We just like to be prepared. I mean, if the fibroids are right in the way of where we're going to be making that incision, then we have to be creative about where we make the incision on the uterus in order to get the baby out. But usually the C-section birth tends to go just fine without any issues. We just want to be prepared to have blood products available just in case there's a significant blood loss.
That makes sense. And too, just you want to be prepared, but also like you just would rather them have a vaginal delivery. It would be
Right.
better.
Yes. Please have a
But
vaginal delivery.
sometimes you can't. So if you can't, there you can still do it and it still ends up fine. So when you do the C-section, is there any time you're already in there? Would you just take the fibroid out at that time?
Yeah, so removing fibroids, even when a woman is not pregnant, can cause a lot of bleeding. And definitely in pregnancy, removing the fibroid can make a woman bleed even more because of the
Mhm.
increased uterine blood flow. So typically, we do not remove fibroids at the time of a cesarean section unless we absolutely have to. And that can happen. It can be right in the place where we're making our incision. Now, remember, most often, the fibroids are going to decrease in size after pregnancy anyway, right?
Yeah, yeah. Yeah. So, what happens if you have a patient who has had a fibroid removed prior to pregnancy? Are they at any increased risk?
So that is a great question, because the answer depends on what type of surgery the patient had in order to remove the fibroid. The issue is that essentially, if we have to cut through a lot of the uterus and remove a big fibroid or several fibroids and then put all of that back together, then that uterus is not going to be as strong as it was before all that happened. And when the uterus is weaker, similar to in the situation of having had
Mhm.
multiple C-section scars, the uterus
Yeah.
can burst open in labor or even sometimes prior to labor. It depends on where the fibroid was. Was it up at the fundus or low down in the uterus? Was it full thickness all the way through the muscle? Or was it just subserosal or just submucosal? How much of that uterine wall was compromised? So, if there was a lot of surgery on the uterus to remove fibroids, then it will not be as strong even after it heals. It will never be as strong as a normal uterus. And that increases the risk of uterine rupture, which can be catastrophic. And it can be dangerous for a baby, including brain damage or even death, but it can also increase bleeding and risk for moms. So, often, if we have a patient who has had an extensive surgery for fibroid removal, we're going to recommend a C section birth before they even go into labor, definitely before they get to 39 weeks, sometimes as early as between 36 and 37 weeks, depending on the extent of the surgery. And because ideally we want to do the C-section in a very planned and controlled circumstance and avoid the risk of uterine rupture.
Yeah, you don't want them going into labor when they have really thin areas of
Right,
their uterus.
right,
So it's really going to depend on your individual circumstance if there's higher risk for that, and things like
right.
multiple fibroids removed or really large fibroids removed that go through the entire thickness of the uterine wall, then they're more likely to need a C-section for delivery.
Right, right. And that's a conversation that we have with our patients at the time of doing a myomectomy procedure. So these patients are going to know before they even get pregnant that they may be at high risk and may need a cesarean section for delivery. And I also want to say that often we remove submucosal fibroids, the ones inside the lining, to reduce the risk of miscarriage. And as long as we don't go into the muscle or it's just done in the lining of the uterus, that can be a very safe thing to have a full term birth, no problem. It really depends on how deep we go into the muscle or if we make a full thickness incision. Those are the ones that are dangerous.
Mm. Okay, that's good to know. Okay, so that was a lot. Let's
Mhm.
recap a little bit. So, fibroids are common, especially in Black women.
Yeah.
Most often, fibroids do not cause problems in pregnancy. But if they
Mhm.
do, the most likely thing is going to be pain, and that can be treated. We don't have a lot of other options besides pain management during pregnancy. We
Right.
don't use hormones or other treatment options during pregnancy. And if you know that you have fibroids before you get pregnant, it's worthwhile to talk to your doctor about how your fibroids may affect your pregnancy.
Absolutely. And it is really individualized, and it may be recommended that you have them removed prior to pregnancy. So do have that chat with your doctor if you know that you have fibroids. But again, most women with fibroids do not have any problems with pregnancy. Also, most women with fibroids have a vaginal birth and know that those fibroids are
Yes.
typically going to get smaller after you deliver your baby. Postpartum, they
Yes.
generally shrink. Yeah.
Perfect. Very nice.
Yay.
I'm really, really glad we did this episode today because, to be
Yay.
honest, I didn't even think about fibroids before I got pregnant with JJ. And I don't know if you remember, but I was like, my very first ultrasound at like 12 weeks or something,
Yeah, I
they told
remember.
me, "Oh, you maybe have a fibroid." And they sent me to see the high risk doctors because of the fibroid. And of course, I'm like terrified Googling what can happen from a fibroid, and all of these scary things that you mentioned come up. So it's really good to have this episode and kind of share. Most women do fine. Most women have a vaginal birth. Pain is the most likely, complication, and it's easily treated. So I'm really, really glad we did this today. And I think, a lot of
Yay.
women, it will help them to feel better and more reassured. But
Yeah.
so, yeah, everyone listening out there, thank you so much for listening to this episode. And be sure to subscribe to the podcast at Apple Podcasts or, wherever you're listening, Spotify, Google Play, Amazon, even has podcasts. And I would really love it if you left us a review.
Yes, definitely. It helps the show to grow. It helps other women to find our show. So please join us again next week for another episode of the Mama Doc Baby Doc podcast. See you next time.
See you next week. Have a good week. Bye.
Bye.